today, I'll be speaking with Executive Vice President and Chief Information Officer at CVS Health, Roshan Navagamuwa. So, without any further delay, please join me in welcoming Roshan. Roshan?
Hey, Sumit. Great to be here.
Roshan, great to have you. And you've been to a VMware event before?
My first VMware event. Wonderful to be back in San Francisco. Come here often, but my first event. Thank you for changing the name for me.
Yeah, we just want to make sure the audience is always up on the toes. So we were having the conversation, Roshan, and you shared some amazing statistics, the role that CVS Health has played through the course of last 2.5 years in the pandemic has been amazing. Over 100,000 medical professionals administered over 50 million vaccinations, more than 30 million tests, and because of all the mental health problems that people have had, more than 20 million visits for mental health. Thank you so much on behalf of everyone. Now, in addition, you also shared some great statistics about your company. And if I were a betting man, I would say almost everyone here has probably been to a CVS Health store over the course of last 2 years. More than 45 million digital visits a day, nearly 5 million people coming into stores. So I am sure that keeps you busy, because all of CVS Health is driven through this tech-forward strategy. The audience would love to know more about that.
That's right. Just hearing you talk about those numbers, Sumit, just puts it into context for me, the scale of the impact that we have. It makes me so proud that technology is such a huge enabler in all of that. And put simply, our technology strategy is to be digital first in everything that we do. And that starts with our consumers, where we think about it in terms of how do we make it easier and more convenient for all of our consumers to be able to access healthcare, right? And then to be able to improve their outcomes as a result of that, and lower the costs, combining with the smartest technology capabilities to do that. And then we also think about it in terms of our colleagues, and how do we enable them with the everyday tools and capabilities to keep those customer promises in this dynamic and fast-paced environment, right? And then how do we enable both those things with the underpinning technology capabilities that are common platforms, cloud-based services and solutions. And so I think of cloud as this underpinning, rising tide effect for our broader technology strategy.
So clearly, cloud's playing a big role in the overall strategy, and you've been on a journey. You've shared that with me. Please do share with the audience your journey.
Yeah, it's been a journey. So we started in the early days with our consumer-facing digital teams, our analytics teams, really taking advantage of cloud in the early days, and they were the first to have meaningful cloud-based solutions. But very quickly, what we found was that there was a broad spectrum of developers that really want to take advantage of cloud as well. And so what started out as this few and small-scale solutions really scaled out to become products and services that are now core to our business and power a lot of what you outlined with the COVID response and such. All of that was cloud-powered for us. And so we found a lot of value in it. But initially, these teams were working in a way that we let them work in a way that was fast, right, with a lot of localized control. Then we realized, hey, we have to pull back. Let's reset. Let's do an enterprise-optimized approach and have a real hybrid multi-cloud software foundation to power it, and really realize the priorities, which I shared with you. Operationally, we have to be secure and resilient, have the right financial controls. We have to have a better developer experience. And then we have to have an ecosystem of reusable products, all of which add up to create that business value that we're trying to do at speed and at scale.
Now, you've talked to me about this inflection point. Your chart shows this inflection point as well. And the inflection points usually just don't happen on their own. There are structural implications and there are organizational implications. Right. So you went through that and made some changes in your teams and structure to make sure that acceleration took place. Please do share that.
Yeah, we did. And frankly, there are people in this room who were the real brains behind it. And what they realized was that we have all these teams, these multiple teams, that work in a loosely coordinated way, and we need to bring them together. And so we now have this unified cloud and distributed services team that owns all of it. And they have a streamlined operating model, and they're really focused on how to make it easy, like Raghu said, for developers, right? And with that, we're able to drive the high velocity of business outcomes that we're really aiming for.
You know, in my job, I get a pleasure to speak with Roshan, CIO like yourself, and many of your peers. And I hear a consistent theme that oftentimes when customers have to start with building new applications and embracing cloud, usually these three teams are there. One that's already been there, which is responsible for private cloud and typical infrastructure. But then, in addition, a cloud ops team as well as a platform engineering team is set up. And soon, once these teams start scaling, there is this little bit of cloud chaos as Raghu described, because not the chaos among the teams themselves, but to the stakeholders, which is developers or business, could be the finance teams as well as security teams, because each of these teams are bringing their own and stovepiped and siloed points of view. And was this any of your experience?
Absolutely, right? So I think chaos is a well-chosen term because when I did roundtables and talked to our developers and architects and our stakeholders, they were not shy about telling me just how confusing it was and how time-consuming it was. And so by unifying all of these teams together and having that streamlined operating model, we were able to, I'd say, make some inroads in solving that problem. We have more work to do, and that's actually part of why our team's here this week, right, to really try to build on that and reduce that complexity.
Yeah, that's exactly right. And we say this cloud-smart model, just like CVS Health has embraced, brings these three key functions together into a converged model so that you're serving the stakeholders that need a unified way of managing your entire infrastructure and getting the information they need in a consistent way. So now, you went through something similar for your colleague experience as well, and the workspace.
Yeah, very similar. We had multiple teams that focused on different aspects of our colleague technology, laptops, collaboration, email, the usual 9 yards. And we said, listen, we need to think about this in the same way, where we have to converge this and not think about these as different aspects of colleague technology, but a unified colleague experience, which is really what we're aiming for. So how do we bring all of that together? So we did a similar move there to bring our teams together, our operating model together, and really focus on experience for our more than 300,000 CVS colleagues, especially the folks on the front lines, our healthcare workers like our pharmacists and nurse practitioners, who need to focus on the patient, not kind of figure out the tech.
So in this new world of multi-cloud, we think a cloud-smart organization would have one team that's responsible for, you called it cloud and distributed services. We'll take the liberty of calling it a multi-cloud team, and then a workspace team that provide these converged functions that we have listed here. So let's transition, and maybe let me ask you, relationship with VMware and CVS Health. How do you see that?
Listen, we love the relationship. We started obviously as partners in simplifying and automating our data centers, expanded that right with our hybrid multi-cloud strategy, really leveraged VMware and your relationship. But really the thing that impressed me the most was not just the great product, but also the implementation support and services that we received. It was really important because that focus on the tech and the realization of the business value allowed us to focus on our core mission as CVS Health on driving consumer-centric healthcare. So we appreciate it.
And how do you change your expectations for us in the future?
Well, build on it, with co-creation, the innovation work that, again, our teams are here talking about, and exploring new solutions. So I think the Explorer concept just makes a lot of sense.
Okay, well, looks like you're sold on the name. Listen, you talked about innovations, and our commitment to you is for the way you have set up your teams. Our commitment is to deliver you unified solutions for that. And obviously, everyone here is also interested in knowing about the innovations. So we will jump into the innovations next. But before we do so, I'd like to have all of you give a big round of applause to Roshan. Roshan, thank you so much.